Okay, so you know how last November, like a huge chunk of Californians voted to increase what Medi-Cal pays to doctors, right?
Right. Proposition 35, the one where they decided to use taxes on health insurance plans to boost those payments.
Yeah, exactly that. I mean, it passed with, what was it, like 68% of the vote? So you'd think by now things would be, moving along.
You'd hope so, especially with that level of support. It seemed like there was a pretty clear mandate to fix the problem.
And the problem being those really, really low rates that doctors get for treating Medi-Cal patients. It's been an issue in California for ages.
Oh, for sure. And it creates this whole ripple effect where, you have enough people with insurance, but they struggle to find doctors who'll actually accept it, especially in rural areas.
Right, so you have coverage, but it's not actually translating to accessible health care. But that's what Prop 35 was supposed to fix.
At least that's the idea, to incentivize doctors to take on more medical patients by paying them better. Makes sense on paper.
Totally. So here's where things get kind of interesting. We're taking a deep dive today into the news that the Newsom administration, well, kind of dropped the ball.
Dropped the ball. How so?
They missed a super important deadline to, get this whole Prop 35 thing implemented, and it's causing, some issues, to put it mildly.
I see where we're going with this. So what happened?
The state was supposed to submit all this paperwork to the federal government by the end of March, the 31st to be exact.
Yes. To get approval for those increased rates, right?
They go. And they missed it.
So, completely missed it. Didn't even get the paperwork in.
Yeah, completely. Which means, as you can probably guess, the doctors who were supposed to get those higher payments starting in January.
They're still waiting.
Still waiting. And not only that, California is missing out on millions of dollars in federal matching funds that were specifically meant to go to Medi-Cal during this time.
Oof, that's a double whammy. Not just doctors losing out, but the state itself, too. Talk about a financial headache, especially with all the other budget stuff going on.
Which, yeah, we'll definitely get into that. But first, let's try and figure out why this happened. What's the official word from Sacramento?
Yeah, gotta get that perspective right. What's the reasoning behind missing something this important?
Well, this is where it gets kind of strange. Our sources tell us that the Department of Healthcare Services, DHCS, the folks in charge of all this medical stuff, they didn't actually respond to any questions about this missed deadline when CalMatters, one of our main sources for this deep dive, reached out.
So initially just radio silence.
Pretty much.
Oh.
But we did eventually hear something from DHCS Director Michelle Bass during some recent legislative hearings. Her explanation: they blamed it on not having all the members appointed to this advisory committee yet.
The advisory committee, wait, remind me, what's that committee for again?
Oh, right, good point. So Prop 35, when they wrote it up, they included this provision for an advisory committee to, oversee how all the money gets spent. Makes sense. Got to have some checks and balances, right?
Right, transparency and all that. Makes sense to me.
Yeah, but here's the thing. They had enough people appointed to legally meet and do their jobs. They had a quorum, as they call it. But there's still one spot open.
Okay, so one empty seat out of however many, and that's what held everything up.
That's what they're saying. And get this. Governor Newsom's office is refusing to say why that one appointment hasn't been made yet. It's a little mysterious, isn't it?
It is a bit odd, yeah. If they had enough to function, why not just get started and, appoint that last person later?
That's what a lot of folks are wondering. And it gets even more confusing because there's a DHCS official who, during a hearing back in February, basically said they never thought they'd hit the March deadline anyway.
Whoa, okay, so mixed messages here. On one hand, they're blaming the unfilled committee spot. But on the other, they weren't confident about the timeline from the get-go. Something doesn't quite add up.
Right. It makes you wonder what's really going on behind the scenes.
Well, regardless of the reason, the delay is a problem, especially for the people who need these changes, yesterday.
Oh, yeah, absolutely. And you can bet folks are not happy about it. Lawmakers, clinicians, they're all pretty frustrated, to put it mildly. They're saying these rate increases are long overdue. We're talking some doctors haven't seen a rate increase for medical patients in 2 decades.
Wow, 2 decades. That's a long time to be stuck with the same rates, especially with how the cost of everything else keeps going up.
Exactly. And they see these increases as the bare minimum to make sure people can actually get the care they need.
Yeah, it's one thing to have the insurance card. It's a whole other thing to have doctors who can afford to accept it.
Right. And we heard from Assemblymember Dawn Addis. She's a Democrat, and she basically said, Prop 35 was incredibly popular, which Obviously, the vote count shows that. And she's really pushing for them to get this show on the road, like ASA. But she also brought up a really interesting point about coverage versus access.
Oh, that's a crucial distinction, isn't it? Just because you have insurance doesn't automatically guarantee you can see a doctor.
Exactly. She specifically mentioned rural areas as a big example. She's saying that doctors in those areas just can't afford to stay open if they take Medi-Cal patients at the current rates. It's just like not financially viable for them.
So even if you have the coverage, there might not be anyone nearby who can actually provide the care. That's a huge issue, especially for people in those more remote communities.
Huge. And Senator Akilah Weber Pearson, she's also a Democrat, and importantly, she's a practicing OBGYN. She had some pretty strong words about all this, too.
Oh, I bet. She's seeing this firsthand, both as a lawmaker and a doctor.
Right. She pointed out that the advisory committee could have met even without that last appointment. They had enough people. And she was pretty clear about being disappointed, that they're basically just letting all this money sit there.
Makes sense. If the goal is to get these funds to doctors and improve care, then any delay is going to be frustrating, especially when it seems avoidable.
And she really hammered home how clear the voters were on this issue. Like, this is what people want.
Right, it wasn't even close. Proposition Think 5 passed by a landslide, so you can understand the frustration when there are these roadblocks popping up.
Absolutely. And it's not just this one deadline. There are, like, a whole bunch of challenges facing medical right now. It's kind of a perfect storm situation.
Oh, like what? Give me the rundown.
Well, for one, the state's kind of bracing themselves for potential federal funding cuts to Medi-Cal. So even if everything with Prop 35 had gone perfectly, they were already looking at a potential budget crunch.
Right, so less money coming in from the feds, not good, especially when you're trying to increase payments at the same time.
Exactly. And then on top of that, Medi-Cal itself has a massive state budget shortfall. We're talking Newsom and DHCS are asking for a $6 billion loan just to keep the program running for the rest of the year.
$6 billion! Wow. That really underlines how serious this financial situation is, and it makes those missed federal matching funds sting even more, doesn't it?
Oh, for sure. And of course, yeah, there are disagreements about why this shortfall is so big.
Always got to be different perspectives, right? So who's pointing fingers at what?
Well, state Republicans are pretty quick to point at Governor Newsom's decision to expand medical eligibility to all income-eligible immigrants, even if they're not here legally.
Right. That was a big policy change, and I'm sure it comes with costs. So they're saying that's a big factor in the current budget woes.
Exactly. They're arguing that expanding the pool of people eligible for Medi-Cal, well, it just costs more money, and that's contributing to the shortfall.
Okay, fair point. What does the Newsom administration say to that?
They're basically pushing back, defending the expansion as, a matter of fairness and making sure everyone has access to health care. They're also pointing at other things that are driving up costs. Like, for example, the cost of prescription drugs keeps going up. And then there's the fact that more and more seniors are enrolling in Medi-Cal. So it's not just the immigrant expansion, they're saying. It's a combination of factors.
So a more complex picture than just blaming one policy change, they argue. Interesting.
Right. Although even Newsom himself has kind of acknowledged that the immigrant expansion has contributed to the shortfall. He says it accounts for about half the deficit.
Okay, so they're admitting it's a factor, but not the only factor. Got it. This is getting pretty nuanced.
It is. And here's another wrinkle for you. Newsom has also partially blamed the medical deficit on, wait for it, Proposition 35.
Hold on. Didn't Prop 35 pass because the goal was to fix the problems with medical payments. How's that part of the problem now?
That's what's so interesting about this. Newsom's basically saying, yeah, the voters wanted this, they wanted those rate increases, but those increases cost money, and that money has to come from somewhere.
Okay, so he's basically acknowledging there's a trade-off. You want to pay doctors more. Well, that money has to come from somewhere, and it might impact the overall medical budget. Tricky situation.
Super tricky, and it really highlights how complex this whole system is. Like, you try to fix one thing, and it might have unintended consequences somewhere else.
Healthcare policy in a nutshell, right?
Never simple.
Never. Okay, so let's switch gears a bit and talk about who was really behind Prop 35. It had some seriously powerful backers. We're talking pretty much the entire healthcare industry was on board. Doctors, hospitals, clinics, even ambulance companies.
Wow, so a pretty united front. What was driving that support?
Well, part of it is, they genuinely want to improve patient care. Higher payments mean doctors can take on more medical patients and everyone benefits, in theory.
Right, that's the ideal outcome. Exactly. But our sources also tell us that there's another layer to this. They say a lot of these healthcare groups were kind of burned in the past. Both Newsom and previous governors had promised to increase medical payments before, but then they didn't fully follow through.
Ah, I see. So a little bit of, we've heard this before and we're not going to just take your word for it this time.
Pretty much. They felt like those promises were kind of empty, and they were tired of it. So they threw their weight behind Prop 35 because it was like a more concrete way to make sure those increases actually happen. No more relying on the legislature to, allocate the funds. This was a voter mandate.
Right. Put it in writing, make it law. I can see why they'd go that route after feeling like they'd been let down before.
Yep. And it's not chump change we're talking about either. Prop 35 sets aside a big chunk of money. Like around $2 billion every year is supposed to go to the state general fund in 2025 and 2026.
Okay, so that's just general state funds. What about the money specifically for those rate increases, the whole point of Prop 35?
That's on top of the general fund money. There's another roughly $2 billion per year specifically for those rate increases and other investments in healthcare providers. So we're talking serious money here.
Wow, yeah. So the intent was clearly to put a lot of resources into fixing this problem. But, as we've been discussing, intent and execution don't always line up perfectly.
That's the truth. And we heard from Stuart Thompson. He's a lobbyist with the California Medical Association, which, as you can imagine, was a huge supporter of Prop 35.
Right. They represent a lot of doctors, so it makes sense they'd be pushing for this. What's Mr. Thompson saying?
He's basically been urging that advisory committee to get together and get to work, like yesterday. And he brought up this point that I thought was really interesting. He said that some payment increases that were already approved back in 2023, they haven't even been implemented yet.
Wait, seriously? So even before Prop 35, there were already payment increases that were just stuck in limbo?
Yep. So the delays are not a new problem. And Mr. Thompson was really stressing how important it is to make sure Prop 35 actually makes a difference, that it really enhances the care for the most needed in California. His words.
So you can hear the urgency in his voice, right? It's not just about theoretical improvements down the line. This is about real people needing access to care, and those delays have real consequences.
Totally. So let's zoom out for a second and kind of summarize what we've learned here. California, despite having this voter-approved plan to increase medical payments, well, they missed a big deadline. And that means those rate increases are delayed, and the state's also lost out on millions in federal funds.
Right. And the reasons behind the missed deadline are still a bit murky. Is it the unfilled committee spot, or were there deeper issues with the timeline all along? Hard to say for sure.
Yeah, it does feel like there might be more to this story than we know right now. But the bottom line is this delay is causing a lot of frustration, especially among lawmakers and the doctors who are, on the front lines of providing care. They see those higher payments as essential to making sure people can actually get appointments and get the treatment they need.
Absolutely. And we can't forget the backdrop to all of this. Medi-Cal is facing some serious financial challenges, potential federal cuts, a huge state budget shortfall. It's a tough situation all around. And this missed deadline, it definitely doesn't help.
Nope, not at all. And it really highlights how complicated healthcare policy is and how even when voters clearly want something, actually making it happen can be a long and, messy process.
It's a good reminder, isn't it, about the difference between passing a law and seeing it through to, real world change. It's rarely a straight line.
No, definitely not. So for you listening, this whole situation really shows how even popular ideas can face hurdles. And it raises some big questions about how we make sure the government is, actually carrying out the will of the people when it comes to healthcare.
And maybe even more importantly, it makes you think about who's holding them accountable, right?
Yeah.
Who's making sure these funds are being used effectively and that the people who need them the most are actually benefiting.
Right. It's about more than just the dollars and cents. It's about real people's lives.
Exactly. And that's something worth thinking about, isn't it? Even beyond this specific situation with Prop 35, what can we as voters do to make sure our healthcare system is working for everyone? What questions should we be asking, and who should we be asking them to?
Those are the real questions, aren't they?
They are. And hopefully, by exploring stories like this one, we can start to find some answers, or at least ask the right questions.
I hope so, because at the end of the day, this is about making sure everyone has access to the care they need.
And that's something worth fighting for.
It absolutely is.